These are the stories of people prescribed VALTOCO diazepam nasal spray for episodes of frequent seizures. Individual results may vary. Talk with your healthcare provider about treatment plans. Please see important safety information at the end of the video. What is VALTOCO diazepam nasal spray? VALTOCO is a prescription medicine used for short-term treatment of seizure clusters, also known as episodes of frequent seizure activity or acute repetitive seizures, that are different from a person's normal seizure pattern in people 2 years of age and older.
Even though I have seizures, I still go out and watch trains and ride my bike.
So when Luke, the night he had his first big seizure, it was very scary. And I mean, I had been a nurse at that point, probably 12 years, and worked with trauma patients and worked in the ER. And so I can only imagine for other families that hadn't even been around seizures, how scary that would be for them.
Mitch is my husband. He is amazing. I told him when we first started dating that I have nocturnal seizures, and it didn't faze him. Mitch has just surrounded me with love and acceptance.
When you see someone have a seizure, it's terrifying to watch. It is. It's just a feeling of helplessness.
I think the best way to start with a day in the life with Luke as his caretaker, mom, nurse, is we prepare for the unpredictable. I've learned to watch him so closely that I know kind of what his triggers are and know when he's gonna kind of start having seizures. I think it's very important to advocate just treatment options for your child. There are so many medications out there. I'm the one who knew that the VALTOCO was out there, and I'm the one that suggested the VALTOCO.
My mom has to administer it, but when my mom's there and she knows what she's doing, then I feel probably the most safest person alive.
I think we've always been close, but I think that fighting this together, he looks to me to help him with it, and he's become more independent with knowing, all right, time to get some rest, time to make sure I took my medicine. So he's taken a more active role in it. I would say that a day in our life these days is a lot easier since we've made progress getting control of his epilepsy.
I think that we move quicker and we move as a team now. If she feels as though she may have a seizure, she says something, and I have a reaction, I have a plan.
If you're a caregiver, then have some kind of a code word or know the signs. When you start to feel that tickle, that little bit of an aura or that focal coming on, that you can yell artichoke or something. And then, you know, the mom or the caregiver or whomever is alerted immediately to grab the rescue sprayer.
It's terrifying to see someone have a seizure, and knowing that we have a way to lessen the effect of that, it's a big difference. And I see it in Reen's confidence.
VALTOCO has given me confidence that I can treat these seizures.
VALTOCO gave me a sense of power to keep my son safe.
VALTOCO is a prescription medicine used for short-term treatment of seizure clusters, also known as episodes of frequent seizure activity or acute repetitive seizures, that are different from a person's normal seizure pattern in people 2 years of age and older. VALTOCO is a benzodiazepine medicine. Taking benzodiazepines with opioid medicines, alcohol, or other central nervous system depressants, including street drugs, can cause severe drowsiness, breathing problems, coma, and death. Serious side effects, including coma and death, have happened in people who have abused or misused benzodiazepines. You can develop an addiction even if you use VALTOCO as prescribed by your healthcare provider. It is not intended for daily use and can cause physical dependence and withdrawal reactions. Like other anti-epileptic medicines, VALTOCO may cause suicidal thoughts or actions in a small number of people. Do not use VALTOCO if you are allergic to diazepam or any of the ingredients in VALTOCO, or have an eye problem called acute narrow-angle glaucoma. The most common side effects of VALTOCO include feeling sleepy or drowsy, headache, and nose discomfort. These are not all the possible side effects of VALTOCO. Talk to your doctor and visit valtoco.com for more information. Please see prescribing information and medication guide.